Dr. Wolski, hi. I know you're specializing a lot in fixing major pains and people with car wrecks. People had accidents. So tell me, what's the average, the typical, if there is such a thing, car wreck accident and injuries which you fix, and why are you good at it?
Well, one thing is, I'll give you an example of, we had a lady, a single mother who was hit from behind by an 18-wheeler wreck. We saw her, we were able to see her the same day that she called, and her vehicle was damaged, so she couldn't drive it, and we have a van that could pick her up. And when she came in, she had insurance, but she was a single mother and with 3 kids, and she couldn't afford the deductible or copay. So we just let that deductible and copay, just let her pay it out when her case settled. So she didn't really have to pay anything out of her pocket. We were able to start therapy immediately. We gave her physical therapy, medications. She later had some imaging, an MRI that showed a herniated disc, and we gave her 2 epidural steroid injections in her office. And when she wasn't 100% better, but she wasn't a candidate for surgery, we gave her an impairment rating, which documents her final impairment at the end of therapy, and we put that in our report to the insurance company. But the advantages at our office is we can give transportation if your vehicle's damaged, and we'll also wait till your case settles before you have to pay anything. So a lot of these folks are financially stressed because of the bad economy and because of the car wreck and their circumstances, and we can definitely help them immediately.
Wonderful. And that's besides the fact that due to the equipment, the machinery, and the type of treatment you do, which is trying not to go and hook a person on drugs, which might mask the pain. And of course, you told me that you're doing that if you have to. Like, when I go to a dentist, I want him to shoot me up before he does a root canal or anything else for that much. But that's different because you're masking the pain while you fix it permanently and fix the cause, and that's really what you're specializing in, to make sure that the body heals itself again, that the body goes back to where it was and doesn't hurt, if in any shape and form possible. So right there, I guess, people do well, but you also, what you're telling me now is you're making it convenient for them to come, because the car might not be damaged, but they may be in a physical condition where they can't drive. So you have, pick them up, and you make financial arrangements, which makes it possible for them to first go through the treatment, and then eventually it might be paid with some settlement anyway, and that's, you're basically taking the risk there that will happen, but no matter what, you're treating the patient.
Exactly, and what we do is try to do, we can give some muscle relaxants and pain medications, but that's not all of our treatment. We can give physical therapy, like I said. We can do electrical stimulation, massage, exercises to build the muscles back up. And if they've got a herniated disc, we can do injections like epidural steroid injections.
Right, which you have talked in great lengths about it in other videos, and people really should go and look at that video of how wonderful those steroid injections are and what they do. You also have that machine, that decompression thing, which apparently does wonders for people, and you suggest lots of home equipment and or home exercise people can do, and people don't realize that those type of things really help if they do the right thing. It's not just about exercising, it's about doing the exact right thing. Am I right there?
That's 100% correct.
Good. Well, wonderful. So people are in good hand with you, and because I know that for other cases, be it workman's comp and certain things, people come from very, very far, even out of the country. I mean, out of the state, sorry. Maybe out of the country, I don't know, but out of the state for sure. Right?
Yes, for our workers' comp, that's exactly right. For our workers' comp folks, we've had people from California, Arizona, Nevada, Ohio, Michigan, Montana. We've had them from all over the country, New Jersey.
That speaks for the effectiveness of your treatment, I suppose. Well, Dr. Wolski, thanks for shedding some light on, and I'm sure there's lots of people out there who will, happy to know that you first treat them, then look for the money afterwards with other sources, and also that you are that you help them to get to you in the first place, knowing that they are injured. So they have a hard time doing so, you help them. Thank you very much, Dr. Wolski.
Thank you.